I work with West Lothian Drug and Alcohol Service, WLDAS, who are a charity that work with people in West Lothian impacted by substance use in some way. So my role is I am the young persons worker. I do also work with adults as well, but my primary role is to work with 12 to 18-year-olds who are impacted by substance use in some way. Doesn't necessarily need to be their own substance use, it could be parental use or other family members. I think predominantly within West Lothian at the moment, it does. There's been an increase certainly over the last 10 years. I would say certainly in terms of ketamine use, and also cannabis, which is kind of used quite a lot. I think having worked with both adults and young people, I think a lot of the people we work with have experienced trauma in some way. And that's the same for young people just as it is for adults. Often it can be maybe some kind of trauma within the family. It could be bereavement, abuse of some sort as well, and that's maybe using a substance as a way of coping. We also have seen, a lot of young people with a neurodivergency diagnosis as well, often using substances maybe for, as I say, to stay in school, because it can be really difficult with someone with ADHD, for example, to stay in a classroom for 45 minutes. So often they maybe use substances such as cannabis to be able to stay within that environment. I think there needs to be more information, and I think the medium through which we give that information needs to change a lot as well. I think projects like this, that you're kind of putting information on platforms such as YouTube and things like that, I think it's the way to go with young people, isn't it? Because often, they use social media such as TikTok, Instagram and things. So, we need to put more information on there about kind of substance use information, but also about harm reduction as well. So if you're going to use substances, how to be safe in that. I'm not entirely sure as to what each individual school would do in terms of interventions and things. I do know that schools are able to refer into ourselves or to the Youth Action Project. So the Youth Action Project can obviously do kind of small targeted groups and things. So maybe if there's a group of pupils, that have maybe been using cannabis, and so maybe Youth Action would go in and do a piece of work kind of targeted towards that small group. Ourselves at WLDAS, we provide one-to-one interventions, so we would kind of provide counselling, so we're able to go into schools to do that as well. So as I say, without knowing specific what individual schools do, I do know that they can kind of refer into services. I wouldn't say so, no. I think that often with young people, they don't know how to access. They maybe often rely on their parent to access GP and mental health services, and depending upon what's going on for that young person, they might not feel able to do that. I think also in terms of wait times for mental health services in particular, really impacts their ability to kind of access these things. So I'm not aware of any local helplines or anything like that in terms of, information advice on substance use. There are national helplines such as Frank that young people can also contact if they're looking for information or advice. But what I would say is certainly if any young person is concerned, they can contact ourselves at WLDAS and we can speak to them. I think the biggest challenges would be accessing young people. I think often, we do predominantly see young people in school, but if that young person, is maybe having difficulty kind of getting to school or is not in school that day, that often we're not able to see them then. So access to young people can be quite difficult. But I would also say, yes, certainly in terms of referrals and things, that often we get referrals from schools, from parents, but the young person hasn't actually consented to the referral. So, unless a young person actually wants to do anything in terms of that, we're not going to force them. So I think a lot of the time it can be really difficult to ascertain whether it's actually the parent or the young person that wants them to make changes. I think, as I said earlier, that certainly it's about how we give out this information to young people. So again, using kind of platforms, but I think often that we still adhere to this kind of just say no attitude when it comes to young people in services, or just don't do it. And it doesn't work like that. I think often it's part of age and stage, you know, that young people are going to experiment with substances, so we need to give them the information. So if you're going to do it as safely as possible. And I think that's where the shift needs to be. Also, again, I think maybe in terms of people with lived experience, going out and providing kind of, information and education, you know, round about substances might help with that prevention side of things, rather than, you know, waiting until the young person is in crisis, that actually we're kind of doing more to prevent that. I think there needs to be more in terms of the projects like what you're doing just now. I think the way we're putting information out there for young people that's easily accessible for them, and it kind of speaks in the way that they understand at this point. So certainly I think that's the way forward, isn't it? Is to give people the information and making sure they're getting that information, but in a way that's accessible for them. Because I think often we just think, oh, they know how to, you know, what the number is for this, or, you know, and often if you're looking on the internet, it's easy when you know what you're looking for. But actually, if we are promoting things on TikTok and things like that, for example, you know, the young person is going to see that.